Let's have a review of the genitourinary system. The genitourinary system, also called the urogenital system, consists of the urinary and reproductive organs. These two systems are grouped together because of their proximity, shared embryological origin, and use of common pathways such as the urethra, which is used to expel both urine and semen. The system is responsible for producing, storing, and eliminating urine, as well as production. The urinary system composed of two kidneys, which forms the urine, two ureters, which conduct urine from kidneys to the bladder, a bladder which receives and stores urine, and a urethra which conducts urine from the bladder to exterior of the body. The reproductive system in male includes the testes, which produce semen and other organs that deliver it. In female, it includes the uterus, ovaries, and other organs involved in reproduction. Urinary system and reproductive system shared pathways, and a typical example is in males. The urethra serves as a dual purpose. It carries urine from the bladder and semen from the reproductive organs out of the body. Due to their close relationship, a problem in one system can affect the other. For instance, an enlarged prostate can impede the flow of urine, and an infection in the reproductive organs can potentially affect urination or lead to conditions like painful urination. So let's have an overview of the functions of the kidneys. The main function of the kidneys is to filter blood, removing waste products and excess water to create urine. Beyond filtration, they also balance the body's fluids, salts, and minerals. They regulate blood pressure by producing hormones like renin. They maintain the body's acid-base balance and activate vitamin D to keep bones healthy. Additionally, the kidneys stimulate the bone marrow to produce red blood cells by releasing the hormone erythropoietin. So the core function of the kidneys include filtration and waste removal, fluid and electrolyte balance, acid-base balance, blood pressure regulation, red blood cell production, and vitamin D activation. What are genitourinary conditions? We have urinary tract infections, urethritis, interstitial cystitis, kidney disease, kidney and bladder cancers. For male genitourinary conditions, we have hydrocele, hypospadias, benign prostatic hyperplasia or BPH, prostatitis, erectile dysfunction, penile, prostate, and testicular cancers. And for female, we have endometriosis, uterine fibroids, ovarian cysts, polycystic ovarian syndrome, pelvic inflammatory disease, ovarian cervical, and endometrial cancer. But for our discussion on the succeeding slides, I will focus more on urinary tract infections and benign prostatic hyperplasia, as these two topics are included in our final exams. So, urinary tract infections are common bacterial infections that affect the urinary system, including the bladder, the kidneys, ureters, and urethra. If you notice in this diagram, kidney infection pertains to pyelonephritis, bladder infection is cystitis, urethra infection is urethritis, and prostate infection is prostatitis. So UTIs occur when bacteria enter the urinary tract and multiply, leading to inflammation and infection. The most common bacteria responsible for UTI is Escherichia coli or E. coli, which is normally found in the gastrointestinal tract. UTIs can affect individuals of all ages and genders, but they are more prevalent in women due to their shorter urethra, which allows bacteria easier access to the bladder. Common symptoms of UTI include stomach pain, fever, back pain, blood in the urine, nausea and vomiting, and a very common burning sensation while urinating. Diagnosis includes a urinalysis, where a urine sample is analyzed for the presence of bacteria, white blood cells, and other signs of infection, and a urine culture to identify the specific bacteria causing the infection and determine which antibiotics are most effective. Antibiotic therapy is one of the most common treatments in urinary tract infection. This includes trimethoprim or sulfamethoxazole, nitrofurantoin, ciprofloxacin, and amoxicillin. It is essential to complete the full course of antibiotics as prescribed by the healthcare provider, even if symptoms improve before the medication is finished, because failure to complete the course may result in recurrence or antibiotic resistance. So if the medication is ordered for 3 days, you have to finish the full 3-day course. And some medications are also for 7 to 14 days. So religiously, you have to take that medication until it is finished. Otherwise, it may result in recurrence or antibiotic resistance. We also have pain relief medications like ibuprofen or acetaminophen, which helps alleviate discomfort associated with UTI symptoms. Drinking plenty of water also helps to flush out bacteria from the urinary tract and dilutes the urine, reducing the concentration of bacteria that can cause infection. We also have urinary alkalinizers, because in some cases, urinary alkalinizers such as sodium bicarb or potassium citrate may be prescribed to reduce urinary acidity and alleviate symptoms of burning or pain during urination. And some studies suggest that probiotics, particularly those containing lactobacillus strains, may help restore the balance of healthy bacteria in the urinary tract and prevent recurrent UTI. So common antibiotic therapies include nitrofurantoin, which is microbid and microdantine. Duration of treatment is 5 to 7 days. Indication is for first-line uncomplicated cystitis. So let's differentiate uncomplicated cystitis to complicated UTI. Uncomplicated cystitis refers to a bladder infection in a healthy, non-pregnant individual with a normal urinary tract anatomy. So short course of 3 to 7 days are typical. While complicated UTI involves factors like male gender, pregnancy, diabetes, anatomical abnormalities, or kidney infection, and this typically requires longer treatment durations of 7 to 14 days and potentially different antibiotics. So for uncomplicated UTIs, we have nitrofurantoin, trimethoprim, fosfomycin, and for uncomplicated cystitis, we have ciprofloxacin, levofloxacin, and cephalexin. So let's move on to another topic, which is benign prostatic hyperplasia, or BPH. This is a non-cancerous enlargement of the prostate gland that commonly affects men as they get older. As the prostate enlarges, it can pinch the urethra, the tube that drains urine from the bladder, leading to various urinary problems. So, the prostate job is to make fluid for semen. It is about the size of a walnut and weighs an ounce or so. It sits below the bladder and in front of the rectum. It goes around a tube called the urethra. The urethra carries urine from the bladder and out through the penis. When the prostate is enlarged, it can bother or block the bladder. Hormones from the testes may be the main factor. For example, as men age, the amount of active testosterone in the blood declines, and estrogen levels stay the same. So BPH may occur when these hormones changes and trigger prostate cell growth. Another theory is about the role of DHT or dihydrotestosterone. This male hormone supports prostate development, and some studies show that older men have higher levels of DHT, so testosterone levels go down. So, what are the symptoms of BPH? We have incomplete emptying. Know the feeling that your bladder is full even after passing urine. We also have frequency. The need to pass urine often, about every 1 to 2 hours. We have intermittency, the need to stop and start several times when passing urine. Hindi siya dire-diretso. Putol-putol siya. Hihinto, and then, feeling mo pa rin, may incomplete emptying ka because your bladder is still full. Then, so, maghihintay ka. Diba? Feeling mo, puno pa yung bladder mo. Pero may intermittency. It will stop and then will start again. And then there's urgency. The feeling, the urgent need to pass urine as you can't wait. Then weak stream. Instead of a normal stream, this one is weak urine flow. Straining, like pinipilit mo. You have trouble starting to pass urine or the need to push or strain to pass urine. And nocturia, the need to wake up at night more than 2 times to pass urine. So these are the symptoms of BPH. What are the medications? We have an alpha-1 adrenergic blockers. Tamsulosin hydrochloride or Tamsuline, as the brand name, works as an alpha blocker by relaxing the smooth muscles in the prostate and the bladder neck, making it easier for urine to flow. Indication is treatment of BPH to relieve symptoms of urinary obstruction. What are the symptoms that tamsulosin helps to relieve in treating BPH? We have frequent or urgent need to urinate, often at night, or nocturia, difficulty starting the flow of the urine or hesitancy, a weak, interrupted, or dribbling urine stream, and a feeling of not being able to empty the bladder completely. So, when a patient is taking tamsulosin, our nursing consideration is to advise the patient to take 30 minutes following a meal. So 30 minutes after a meal, that's when tamsulosin is given or taken by the patient. And do not open, chew, or crush. So ibig sabihin, this is enteric-coated. So adverse reaction includes headache, chest pain, dizziness, insomnia, decreased libido, and erectile disorder. Tamsulosin also common generic is, common brand name is Flomax. So when you hear about tamsulosin hydrochloride, it's Tamsuline, Flomax, and Rafaclo. Another medication is 5A reductase inhibitor. Generic name is finasteride, and the brand name is Proscar. It works by inhibiting or blocking the enzyme 5A alpha reductase that converts testosterone to dihydrotestosterone or DHT, a hormone responsible for prostate growth and hair loss in men. It's given in men with BPH and androgenic alopecia. So for BPH, it's Proscar 5 mg OD to help improve symptoms like difficulty urinating, weak stream, and nocturia. And for male pattern hair loss, Proficia 1 mg OD. It can also be given for a female in cases of hirsutism, where there's excessive growth of thick hair in a male-like pattern, such as on the face, the chest, back, or abdomen. But Due to its potential to cause severe birth defects, it's not safe for women who are pregnant or may become pregnant, and it must be avoided by women of childbearing years. Postmenopausal women or those on contraception with no plans to become pregnant may be candidates for this treatment. So, there's a pregnancy warning, as it should not be handled or crushed or broken tablets, as it can be absorbed through the skin and can cause birth defects in male babies. So administration of this can be given with or without food. Side effects include impotence, abnormal ejaculation, dizziness, swelling in hands or feet, weakness, headache, skin rash. Nursing consideration would include advising the patient to notify healthcare professionals to promptly report if changes in breast like lumps, pain, nipple discharge occurs. Also inform the patient that there is an increased risk of high-grade prostate cancer in men taking this medication. With caution female patient that finasteride poses a potential risk to a male fetus. Also, finasteride can affect the results of PSA or prostate-specific antigen blood test. So normally, when a patient is for PSA testing, uh, finasteride is put on hold. Another medication is an antimuscarinic drug, trospium chloride. This drug acts by blocking the action of acetylcholine at the muscarinic receptors. It treats an overactive bladder by relaxing the muscles in the bladder. And this medication can be given to both men and women because both genders can have an overactive bladder. It helps manage symptoms like urinary urge, incontinence, or loss of bladder control, urgency, and frequency. So it works by relaxing the bladder muscles and reduces contractions, which helps the bladder store more urine and reduce the urge to urinate. So normally, if your bladder is working well, when we take in fluids, it will take 3 hours, 2 to 3 hours for us to feel like our bladder is full. But an overactive bladder will have urgency and frequency. So administration, this medication should be taken an hour before a meal or on an empty stomach because food, especially high-fat meals, significantly reduces its absorption. It's available as an intermediate release or as an extended release capsule. Common side effects include a dry mouth, constipation, dry eyes or blurred vision, and a headache. For our nursing considerations, trospium can interact with alcohol because it increases drowsiness and should not be consumed within 2 hours of administration, meaning alcohol should not be consumed 2 hours after taking trospium. Or better yet, advise the patient not to drink any alcohol. Angioedema or the swelling of the face, lips, or throat can also occur in some cases. So for review, I would like to take note of the difference between mechanism of action between tamsulosin and finasteride. What are the primary mechanism of action of both medications? So also review about nursing consideration as this will be added in the final examination. So good luck guys.